Jones?
Yes.
I'm calling about one of your patients at Baptist Hospital who's throwing up all over the place. I'm not sure what you want me to do. We've given her 25 milligrams IV of Reglan, and it hasn't helped her yet.
Who is the patient?
Nancy Jones? No, it's Johnson. She's, let's see, old and was admitted a couple days ago.
Well, when did she start to vomit?
I'm not sure. Let me go ask the tech. Hold on. Doctor, I'm sorry for the delay. You wouldn't believe how short-staffed we are here today. I am so overwhelmed. Now, back to Mr. Newman.
I don't have a Mr. Newman as a patient.
Oh, I'm sorry. Could you hold? I think I picked up the wrong line. Okay, Dr. Jones, I'm back. You wouldn't believe what I just did. I was talking to the wrong doctor on the other line. Anyway, I have what you need regarding Miss Johnson.
What seems to be the problem?
The other nurse told me that she started puking about 20 minutes after she hung the IV.
Ah, yes. I recall changing 2 of her antibiotics. Do you know which bag of fluid was hung?
I knew you were going to ask me that. Let me put you on hold again while I go check. Hey, Jill, what was the name of that medicine that you hung for that lady in room 225?
I don't know. I was just filling in while you were on break.
These nurses, they obviously didn't go to Aquinas to learn the SBAR method.
Dr. Jones, I cannot find this woman's chart. Can't you just tell me what to do?
No, I don't need specifics. Is your supervisor there?
I don't know where my supervisor is. She is always taking a break, so she's probably on another break. What she needs to do is get out here and help us take care of this patient load.
You are an irresponsible nurse. Don't you keep up with the meds you give? And aren't you supposed to monitor the effects of a new drug?
Well, doctor, aren't you supposed to check to see if the patient has allergies before you prescribe a new medication? It seems to me we wouldn't have this problem if you guys would do your part. Hello? Hello? Hello?
As you can see, this was a communication nightmare. The nurse is upset, the patient's in the room puking, no one knows what to do. Let's look at this same scenario with the use of the SBAR communication technique. Do you know what the SBAR communication technique is?
Good morning, Dr. Johnson.
Yes.
My name is Lisa Berger, and I'm a nurse in Baptist Hospital on 7 Stringfield. I have Mrs. Amy Johnson. She's one of your patients that was recently admitted for a broken hip. You changed a pain medication for her from Percocet, and after 20 minutes of administration, she developed nausea and began to vomit.
What are her vitals?
Her pulse is 73. Her blood pressure was 134/90. Temperature was 99.2. Further assessment included dizziness and hyperactive bowel sounds. The patient's not able to tolerate any solids or liquids at this time. Her last meal was 2 hours ago, and she ate 90% of that.
Does she currently have any other standing orders?
Yes, she does. 25 milligrams of Reglan, PRN every 4 hours, and Tylenol. I would recommend a little more Reglan or try a small amount of Zofran. If after 10 milligrams additional medication with no improvement in an hour, I'll call you back.
Yes, try 10 milligrams of Zofran and call me back in an hour if no improvement.
Okay?
Thank you for your update and your responsiveness to her situation. If you get situation, background, assessment, and recommendation, you are correct. As you can see, SBAR helps facilitate good communication by making it more professional and organized. This saves time for both the doctor and the nurse.